MLT Case Study Series 16. Topic: Unraveling the Itch, a candid look at vaginal candidiasis. A medical laboratory technologist's guide to diagnosis, interpretation, and treatment. Introduction to Candida infections. Candida species are a significant cause of vaginal infections, presenting a range of symptoms from itching and discharge to painful urination and intercourse. These fungi are part of the normal flora of the mucous membranes but can overgrow under certain conditions, leading to infection. Importance for medical laboratory technologists. Medical laboratory technologists are crucial in the accurate detection and identification of Candida species. Their expertise ensures the appropriate management and treatment of patients, minimizing complications and the risk of recurrent infections. Sample case study: Jane Doe. Patient presentation. Age: 28 years. Symptoms: Jane presents with itching, vaginal discharge, and discomfort during urination. She reports no recent antibiotic use or significant medical history. Concern: Jane is concerned about the possibility of a sexually transmitted infection, STI. Diagnostic tests. Wet mount microscopy: a sample of vaginal discharge is examined under a microscope for the presence of yeast cells and hyphae. Culture: a swab from the vaginal discharge is cultured on sabouraud dextrose agar to isolate and identify the Candida species. Gram staining: this is performed to exclude other bacterial causes of vaginitis. pH testing: vaginal pH is measured to differentiate Candida infections from bacterial vaginosis or trichomoniasis, which typically present with a higher vaginal pH. Results: wet mount microscopy, budding yeast cells and pseudohyphae were observed. Culture: Candida albicans was isolated after 48 hours of incubation. Gram staining: no bacterial pathogens were identified. pH testing: vaginal pH was within the normal range, 4.0 to 4.5, consistent with Candida infection. Interpretation: the presence of budding yeast cells, pseudohyphae on microscopy, isolation of Candida albicans from the culture, and normal vaginal pH strongly support the diagnosis of vaginal candidiasis. Treatment: Jane was advised to avoid irritants and was prescribed an antifungal treatment. Topical: clotrimazole 2% cream applied once daily for 7 days. Oral option: fluconazole 150 mg, single oral dose, if symptoms persist or recur. Conclusion: the detailed analysis and identification of Candida species by medical laboratory technologists are essential for the effective management of vaginal candidiasis. Accurate diagnostic testing guides appropriate treatment decisions, improving patient outcomes. This case study underscores the importance of laboratory diagnostics in the clinical management of infectious diseases. Further learning. For medical laboratory technologists interested in expanding their knowledge on this topic, it's recommended to review the various Candida species and their resistance patterns to antifungal medications. The role of emerging technologies in the rapid identification of fungal pathogens. Case management of recurrent or complicated candidiasis. Thank you. Please subscribe for more videos.